Morning.
Morning.
Good morning.
Morning.
Thank you, Sarah. I came here with my wife. We've been here since Saturday, so we've seen a lot. This is the first time I've been to New Orleans, and we've had time to really explore stuff on our own. So it's somewhat comforting to see a crowd that has fewer tattoos, more clothes, and presumably a lower blood alcohol content. Thank you for that. I think Sarah read my bio, so I don't want to repeat it all, but I spent a long time as a journalist in Michigan, reported on environmental issues, worked for 8 years at Michigan's leading nonprofit environmental policy advocacy agency, the nonprofit, the Michigan Environmental Council. We work closely with CHEE there on a number of state-level energy efficiency issues, and Kresge also supports CHEE, so I'm familiar with the great work this organization does. And I'm really excited to see this new track and the nexus with health. An obligatory bit about Kresge. We work to expand opportunities for low-income persons in American cities through grant making and social investments in nonprofit organizations, including advocacy groups, think tanks, and sometimes in opportunities like this conference when it aligns so squarely with our mission and our values. We do this work in our hometown of Detroit and across the U.S. in cities in program areas that include education, arts and culture, human services, health and the environment, and through our social investments in American cities practices. I am embedded with our communications department, where I work with the environment program and also the arts and culture program. The environment program helps cities implement comprehensive climate resilience approaches grounded in principles of equity. We want cities to factor climate change into decisions about infrastructure, land use, building codes, public health, and every other urban planning decision that's relevant to climate change mitigation and climate change adaptation. So I probably don't have to lay out for this crowd why climate change is the defining issue of our time. It's an infrastructure problem that requires engineering solutions. It's a land use problem that requires planning and zoning solutions. And for certain, it's a massive public health problem, particularly for elderly people, people with low incomes, and often those with communities of color. These are people in places that historically have been hit first and worst by climate change-fueled disasters and problems like storms, hurricanes, floods, heat waves, and sea level rise. Residents in these places are often the least equipped financially to either avoid these impacts or recover from them, or to have a significant voice in shaping the policies that determine where resources are directed and who gets them and who is prepared to be resilient for these disasters. These challenges are ably documented in the Human Health chapter of the recently released 4th National Climate Assessment. One of our Environment Senior Program Officers, Joanne White-Newsom, was a co-author of that chapter. It details the myriad detrimental health impacts that are associated with climate disruptions. Those include floods, fires, high heat, diseases, decreased food security, and the deterioration of mental health. The chapter concludes that the risks of climate change for human health are expected to increase in the future. The sooner we aggressively address climate change, the more likely we are to shave the peaks off those worst-case graphs and projections. Our environment program is trying to, they say, bend the field toward comprehensive and equitable climate resilience solutions. Our work encompasses a broad definition of resilience with 3 legs. To successfully address climate change, we need to get serious about 1, mitigation, reducing the emissions of greenhouse gases and other pollutants that accelerate climate change and saddle communities with unhealthy air, contribute to high rates of asthma, heart disease, cancers, and low birth weights, to name a few. Efficiency is clearly the most important and cost-effective way to achieve mitigation progress. The cheapest kilowatt is the one that's never used. I stole that from CHEE. Marty gave that to me back in Michigan years ago. Number 2, adaptation. Investments, policies, and community design aim toward minimizing the harmful impacts of climate change-fueled disruptions and disasters. And 3, social cohesion. A people-focused approach to resilience that aims to strengthen community connections and the social fabric that helps people respond collectively, forcefully, and compassionately to climate change impacts. To be effective, we, our grantees and our partners, must work across disciplines, sectors, and ideologies to bring a truly integrated approach to solutions that recognize the interwoven nature of climate change impacts. That's why we're so enthusiastic about supporting this conference, ACEEE's first to formally connect energy with climate and health. At Kresge, we're increasingly trying to work across those program areas and professional disciplines to create the kind of comprehensive solutions that are more impactful than just the sum of their parts. Philanthropy is weird, but it's in a unique position to partner with people and organizations in other sectors on such ventures. We have the luxury of being able to step back and try to see the whole picture, looking for connections and opportunities. We have an extraordinary ability to take risks. We're not beholden to shareholders, nor must we justify pilot programs or speculative ventures to taxpayers. We have a substantial toolbox that consists not only of grants, but equity investments, the commissioning of research, and convening disparate groups of people to learn and coordinate efforts among themselves. And perhaps most importantly, we can focus on people who have traditionally been left out of the economic and social mainstream. Some examples of Kresge's work that brings resources to bear on the climate health nexus include: 1, our support for ACEEE, first and foremost, of course, to deepen its engagement with cities and help position energy efficiency as a strategy for economic growth and climate resilience. We're supporting the infusion of equity-centered metrics into ACEEE's City Energy Efficiency Scorecard, which assesses the efficiency policies of more than 50 large U.S. cities. We also supported technical assistance opportunities and toolkits for cities that ACEEE works with. 2, our environment program and social investments practice partnered with Connecticut Green Bank to deploy solar plus storage batteries on housing units in community buildings in low-income neighborhoods, and to develop a model of financing for clean energy storage solutions. These systems make communities more resilient when power outages occur, particularly for people reliant on energy continuity to power oxygen machines, air conditioning, and other systems that are critical to health and well-being. We also, number 3, we're partnering with the CERDNA and JPB Foundations. We did partner with CERDNA and JPB Foundations to commission a report from the Clean Energy Group last year. It assesses the state of the solar plus storage field and identifies barriers to deployment in low-income markets. It proposes more than 50 grant and investment opportunities that socially minded investors can use to target those barriers. 4, we're supporting the Trust for Public Lands Climate Smart Cities program. It works with community leaders and local residents to design, fund, and build climate-smart parks and green infrastructure that connects people and protects neighborhoods from flooding and excessive heat. It connects residents through innovative engagement strategies like creative placemaking, the integration of arts, culture, and design into infrastructure and planning decisions. 5, we work with Healthcare Without Harm, who's represented here, I believe, to help embed climate resilience and environmental sustainability into U.S. healthcare operations. That includes tools for hospitals to identify and address climate risks to their facilities and communities, establishing criteria to make purchasing and procurement more environmentally conscious, and accelerating the adoption of energy efficiency and renewable energy. 6, we're preparing to launch a new multi-year initiative aimed at strengthening leadership among community-based groups to accelerate the adoption of climate resilience policies that reduce health risks. It will combine on-the-ground work from local organizations to drive smarter policies and practices with an array of learning opportunities, technical assistance, leadership training, and communication support. We'll launch this request for proposals for that cohort in early 2019. So please stop by and sign up for our newsletter so you can hear all about it. We have a table outside. And we're referring to this internally as the Climate Health and Equity Initiative. And we're still struggling for a good acronym. Maybe you can help us with that. But my suggestion of CHEE has been repeatedly introduced, and I don't know why. And so that in a nutshell is kind of what Kresge does. We fund community groups. We believe that a lot of the solutions to climate change are driven from the ground up, and that we try our best not to be in an ivory tower, our program people do, and to let communities devise their own solutions, especially low-income communities. They know best what's good for their communities, and we try not to dictate it to them other than broad outlines. So it's really interesting to visit some of these places to see how things are landing on the ground in different cities, and how they're sort of operating and building climate resilience into the work they do. As I said, this is my second visit to New Orleans. My first one was as a journalist in the summer of 2005, and that was 4 weeks after Katrina tore the community apart. If you remember, that was a hurricane that was supposedly going to snap our republic out of its climate change denial stupor, generate public outrage, and catalyze feckless federal politicians to take action. That didn't happen. And it's discouraging, but there's a little bit of perspective in the story that I recall from that visit to New Orleans. I was paired with a local photographer, a good old boy driving his pickup truck bombing around New Orleans in this hellscape. And we linked up with a husband and wife who were returning for the first time to inspect the damage to their parents' home. And they had a van that was filled with sponges and Lysol and rubber gloves. And we pulled in behind them and talked to them a little bit. And they said, okay, so we're going to go open the house and we're going to start cleaning it up. And when they cracked the door, all of us just stood in mute disbelief, looking at the horrifying scene inside. There was, the overpowering stench of rotting food, swollen, decayed drywall, thicker, elaborate swirls of mold laced across walls and ceilings. How they would ever make that home livable again and healthy again was beyond me. Our next stop was at a home where the owners had been working on cleanup for several days, and frankly, it looked like they hadn't made a dent in it. It looked like they had just started. And this seemed so overwhelming. I said to the woman, this seems so incredibly overwhelming. How do how do you keep from being discouraged? And she barely stopped from her scrubbing, and she looked up and she said, well, will you tell me what the alternative is? We also have no alternative. There is no plan B, the saying goes, so we had no choice but to continue addressing the interrelated issues of climate, health, energy, and equity with creativity, urgency, and passion. So thank you to ACEE and all of you working for a better future for everything